So as I said, the most popular database on the medical campus by far is PubMed. You could certainly go to PubMed just by typing in pubmed.com or pubmed.gov, but we really recommend that people go to PubMed through the library website, only because we can actually link our holdings to PubMed. So the way you can do that, I'm just going to back up here to the library homepage here. You can see there's a link to PubMed right here. I can also get there here from Medline. The top option is PubMed. Either way is going to take you to PubMed. So if I click here, you can see that now that PubMed knows that I'm coming to PubMed through BU, up here there's this easyproxy.bu.edu and the address. So that is me telling PubMed, or the database or the website telling PubMed, I'm affiliated with BU. So again, any of the articles we own are just going to be linked to this directly, which is nice. Okay, so say for example, the research that you're doing a study on, say, diabetes in India. So we know that diabetes right now is an epidemic all around the world, and it's especially really affecting developing countries because they haven't had the ability, they maybe have enough nutritional resource before for people to develop diabetes. Now that they're getting wealthier and people are eating kind of a more terrible Western diet, they're also developing diabetes. So people tend to search PubMed like they search Google, which is not the most efficient way to search PubMed, but again, I'll talk about that in a second. So most people in this case, if they were looking for diabetes in India, would just type in diabetes India, sort of like you would do in Google. Oops, again, I told you I can't type or spell. So it's nice that PubMed tries to auto-complete for you. So that doesn't mean these searches are any good, mind you. It just means these are searches people have done most often in PubMed. So I'm just going to type in here diabetes India, do a search. So I get 11,000 results back. They teach us in library school that the average person, when they do a search in a database, if they get more than 100 results back, they start to panic. So clearly 11,000 is way over our panic threshold. The reason why this happens, there are a few reasons why it happens. One, that PubMed is actually designed to get you back as many results as possible. Again, the average person who uses PubMed doesn't really understand how PubMed works. So they actually feel sort of comforted when they get 11,000 results back. So they feel like if there's 11,000 results, the right answer must be in there someplace. Whereas someone like us, who is really experienced using information, we realize that with 11,000, it's really hard to separate the wheat from the chaff. I don't know which of these articles of 11,000 is actually good. I don't have time to plow through 11,000 articles to get to the one that's actually useful. The other reason why PubMed brings back so many results is that one of the secrets really of PubMed is that PubMed really doesn't search for the terms that you typed in. It converts the terms that you typed into the terms it prefers for that concept, and then searches for those terms first, and then it searches for the terms you typed in. So what do I mean by that? If I scroll down to the bottom right-hand side of this display here, see where it says search details, and I click on see more, I typed in two words. I typed in diabetes India, and now PubMed brought back all this stuff. So what PubMed does, like I said, if you type in a term, it converts it to that term it prefers instead. That's called a controlled vocabulary, when it uses its own terminology for something as opposed to the terminology you used. And you can see here that the preferred term for diabetes is actually diabetes mellitus. Now, something that I didn't type in, but I would know this if this were my search, I'm really after type 2 diabetes. That's the really dangerous one. That's adult onset diabetes. That's really the problem for people as they, in later life, that's really the one that we're worried about when we talk about usually diabetes being an epidemic. So because I wasn't specific enough in my search, PubMed's actually searching diabetes mellitus, which is not specific enough. So I'm sure if I look at all 11,000 articles, I would find some useful ones, but a lot of ones that aren't useful are going to come back. So PubMed search for that right term by itself, but it's actually too broad. The next thing I see, it says diabetes all fields. So it's just looking for the word diabetes itself, and all fields means it's looking in the article title, it's looking in the journal title, it's looking in the author name, it's looking in the text of the abstract, and then any captions attached to that particular article, the images, the captions, and the images. So this gets too broad too, because say you're searching for lung cancer, there's actually a person named Lung, and there's a journal called Cancer, so all those results would come back looking for lung all fields and cancer all fields. You don't want that. So it's something that's too broad, again, the way that it does things. And it's also looking just for mellitus in all fields. It's looking for diabetes mellitus in all fields. It's looking, again, for India as a mesh term, which is great, because most countries actually are their own mesh term, and then India in all fields. So this actually is a live search box. If I wanted to, I could just get rid of all this other stuff, say, and delete it. And I could click here on search, but I'm still starting with the wrong term. I really want diabetes mellitus type 2. So we tend as librarians to search PubMed directly by this controlled vocabulary, by this mesh, so we can get as much control over our search as possible. So I'm just going to go back here. Sorry, my mouse is a little screwed up here. I don't quite know what's going on with my mouse. So, excuse me for 1 second here. I'm just going to try to do something with my mouse. Okay, so I can go back to PubMed. So I want to do a better search starting directly with that mesh database, not with just doing what we call a natural language search, like a Google search, is typing in the words that occur to you naturally. So there are a couple of different ways I can get to the mesh database where I can search for mesh directly. You can see there's an option right here for mesh database. I can click here and go to mesh. But at some point when you come to PubMed, some morning when you open up PubMed, all of these options here are going to be gone. The designers of PubMed feel like it's kind of too cluttered. They don't like this look. It's too, like I said, cluttered. So at some point, all these links here are going to go away. That was supposed to happen in the summer of 2010. So I'm not quite sure when it's actually going to happen now that it's August of 2015, but that's probably still right on time for, Washington, D.C. But anyway, if you want to be safe, the one thing that's always going to work, I can hit this drop down here. You're always going to see mesh here. Now, in my case, mesh is here because I've used mesh recently, but normally it wouldn't be here. It would just say PubMed, and I could just get to mesh here alphabetically. But the nice thing is, after you click on mesh once, it is going to go number 2 in this list because it's something you've used recently, which is nice. It kind of remembers the resource you've used most often. Okay, so I'm just going to type in here diabetes again. And again, I still can't type or spell. So it tells you there are 100 mesh terms with diabetes in the title. And like I said, I know that really the one that the epidemic sort of onset, adult onset one that's a problem people talk about when they talk about diabetes is actually type 2. And you can see number 8 in this list is actually diabetes mellitus type 2. So that's really the one I want. So I'm just going to click here to look at this term. So I can see that there's this little paragraph here describing type 2 diabetes. PubMed calls this the scope note. So this is how PubMed defines this particular term. This is really important if you don't know in public health because there are times that what PubMed calls something is not what you call it in public health. For example, we did a search a few years ago for Professor Jen Beard about orphans and vulnerable children. That's a very common public health term, usually abbreviated as OVC. PubMed at the time, this was probably 2008, didn't even have orphan as a mesh term. It just had child. So it didn't have vulnerable children, didn't have orphans, just child. So I suppose that every orphan is a child, but not every child is an orphan, so it's really not a good fit. Another example, again, about 10 years ago, right around this time, we started seeing literature about Hurricane Katrina. So people that lived in New Orleans that had to move to, say, Texas or some other state, in public health, you would call those people internally displaced persons. So they're still in their home country, but they had to leave their original region or state or province to go to another part of their country, and in some cases it's just because of like crop failure or the weather. It's not usually for political reasons, although it can be. The only term PubMed had is refugee. Now refugee is totally different. It's usually someone who has to leave their home country to live in a different country for political reasons, for war, civil war, something like that. So refugee really isn't a good fit for internally displaced person, but that's all that PubMed had, so you have to use it. In this case, though, I think this is fine. I'm not a biologist, but this seems like it's a pretty good description of what type 2 diabetes actually is. So you can see that usually when you see terms that are bolded, that just means that's another mesh term. So ketosis is a mesh term, obesity is a mesh term. So that's something we know those are other mesh terms I could use if I wanted to. It tells me here that this term was modified in 2005. It was actually created in 1984. This is good to know because PubMed, they actually started building the PubMed database in 1963. They started populating it, putting articles into the database in 1966. So this is PubMed telling me this term was not original. It didn't start until 1984. So I think doing our research now in 2015 with 31 years worth of articles to go back for this term is fine. But if you were writing a book chapter, if you're looking for a topic such as HIV, the name for HIV changed over the years. In the early 80s, they really didn't quite know what it was yet. So it was usually indexed on things like Kaposi sarcoma, which was an opportunistic infection that many people infected with HIV also got along with HIV. In some cases, I think in 1987 it was just under HIV-3, and from 88 on it's been HIV infection. So if you wanted articles about HIV from, say, 1982, you would have to go back and use the term that they used for that period and add that to searches you've done for other periods. So if you want to know what the term was previously, you'll normally see down here where it says previous indexing, and it tells you that it was just under diabetes mellitus from 66 to 83. These little boxes here, so PubMed has what they call subheadings. If I just wanted a specific aspect of my topic, so I just wanted to know about the best way to treat diabetes, I could just click here on therapy, and I would bring back only articles about therapy and type 2 diabetes mellitus, but we usually like to start kind of broadly and then go from there. You can also see the beauty of using a mesh term here, control vocabulary. All of these different ways to describe type 2 diabetes these entry terms are all synonyms. If I were searching Google and wanted every single article about type 2 diabetes I could find, Google doesn't have a controlled vocabulary, so I have to put all these together with an or. So I have to say maturity onset diabetes or non-insulin dependent diabetes mellitus or adult onset blah blah blah. That would just take a long time if I wanted to get everything. Because every article that's in the Medline subset of PubMed with these mesh terms attached is actually indexed by a person, they do all that for you. So it's a great little shortcut to use, and it just makes it more specific and also makes your life a lot easier. Finally, if I go down here, this is what's called the mesh tree. So things are organized in mesh in a hierarchy, and it's sort of like the order, kingdom, phylum in biology. It goes from broadest to most specific. So really broadly, diabetes is a disease. That's obviously pretty broad. So more specifically, it's a metabolic disease. More specifically than that, it's a glucose metabolism disorder. So if you do a search and you don't get enough results back, so say there was only like 50 articles on type 2 diabetes mellitus, I could step up here to the parent term of diabetes mellitus, and so it would take me a little bit more to weed through, but I get a lot more results back. They also recommend if you had a more specific, I just wanted this lipotrophic diabetes mellitus, just search here again to be as specific as possible, eliminate the kind of broader terms, and go right here for this one. Any term to the right of the term you search for is automatically included. So type 2 diabetes is also going to search for this lipotrophic diabetes mellitus as well. It's kind of a weird example, which I don't know why I'd ever do this, but the National Library of Medicine says, say you were searching for eyelashes, don't search for eyelid, even though that is the kind of parent term, because that's obviously broader. Don't search for eye. Start with eyelash. If eyelash doesn't work, you would go up to eyelid or eye. Like, don't search for head or face because it's going to be way too broad. So try to use the most specific term that you can that seems useful to you. If that doesn't work, step up one. And if that relevant term is too broad, step down one to the next most logical term. But in this case, I think diabetes mellitus type 2 is fine. So I'm just going to scroll back up here. There are no articles in this mesh database, just these 30,000 mesh terms of preferred concepts for things. So if I want to search PubMed, I have to build a search and send it back over to PubMed. So I'm going to click here on Add to Search Builder and then click on Search PubMed. So now this is every article in PubMed on type 2 diabetes mellitus. There's 91,000, but I haven't searched for India yet. So I'm just going to go back up here and click on Mesh again. I'm just going to type in India. And like I said, I think every country in the world, maybe not new country, maybe not South Sudan, but almost every country is a mesh term, which is nice. So I can click here on India. And you can see that not only is India here, but Sikkim is also here again as a state or a province, so it's kind of more specific. But you can also see that they always have kind of a geographical breakdown. So if I didn't get enough articles for India, I could go up to Western Asia or Asia itself. This also works really well for any country in Africa. You can see if it's like Eastern Africa or Sub-Saharan Africa. There's also a great mesh term for public health developing countries. So it's not any one specific country, but it's all those developing countries. So say you were doing a search for Haiti and you couldn't find enough articles for some intervention in Haiti, you could search for developing countries instead and see if some other developing country used that resource efficiently and effectively. And you can kind of say, if it worked in Kenya, why wouldn't it work in Haiti? That kind of argument. But and it's nice that India is a mesh term. If you choose more developed countries like, say, the United States, every state of the United States is its own mesh term. So Massachusetts is a mesh term. Boston is its own mesh term from there. So it's nice if you're doing work on, say, Chicago or New York City or Boston. A really developed city has its own mesh term, so you could just look for public health interventions for a certain condition in Boston or Chicago or Illinois. So it's nice to have a lot of control over more developed countries and cities. But in this case, India is fine. So I'm just going to click here again to my Add to Search Builder and search PubMed. So now this is a search for every article about India in PubMed. Again, it's 78,000 just on India. But I obviously want to combine those two things to get type 2 diabetes mellitus and India. So I'm going to click here on advanced. PubMed keeps track of every search you ran over the last 8 hours as long as you don't close your browser out. So I want to combine these two. I want to have an intersection of India and type 2 diabetes. So I click here on add, and you see it added that to this box here. I click on add next to India. So now it built the search for me automatically. I click on search, and now it tells me using the search for mesh terms, now there's 920. So what I had done before, right, I think when I did India and diabetes, I got 11,000 results back. Now I get 920. Now that's still over my panic threshold of 100, but it's, I limited 90% of those articles that were kind of irrelevant. So I really did a nice job of trimming it down. The next step you would want to do is kind of look at the sort of type of publication or type of article that you want. So if you're coming to this you're coming to this search for the first time, say you know nothing about diabetes in India, which is perfectly fine. I don't know anything about it myself. You have to start someplace doing research. You might just want to look at, say, review articles. That's going to give you a nice overview of the state of the literature today. So I can just click here where it says article type review. So now these are just going to be review articles. Now there's only 70 review articles to come back, which is nice. You can see, for example, this second one here is case control and meta-analysis. So a meta-analysis or a systematic review, most people use the terms interchangeably. They're not the same, but they're close enough for government work, as the old expression goes. So that's that's sort of like a much more advanced review article. It's a review article based on kind of the best studies they can find. Usually a systematic review looks at every paper out there they can find. The authors will look at hundreds of papers. They'll only include the ones where the methodology is the most sound, with really good collection techniques and really robust sets of data, and draw conclusions based on those. So if you wanted to see, say, systematic reviews or meta-analyses, you can see that by default, PubMed only shows me 2 article types here. If I click on customize, I can go down. There's about 100 different article types total. I can say here if I want systematic review, I can turn that on. And now when I click here of these 920, it shows me there are 22 systematic reviews. You can also do things, the limits in PubMed are called sticky, so unless you turn it off, it's going to stay on here. So it's usually a good idea just to turn it off in between searches. Maybe I was just interested in, because, type 2 diabetes usually affects adults. So maybe I just want to look at articles about adults. So if I click here on show additional filters, I have different things here like the age of the subject I'm looking for. I could also look here for, say, sex. I want men or women. So I can say here I'm going to turn on, so I just want, say, men. And I'm going to say all adults, so 19 to 44. 19 plus, and now that's 623. And again, I could look for, say, review articles about men over the age of 19. So now there's 6 articles about that and India. So it's really nice. You can really start to limit the resources down to the type of information you're after pretty quickly using these filters in PubMed. So just to go back for a second, though, just because sometimes you also in PubMed it's easy to kind of get lost, that you kind of forgot how you got here. You want to look at those 920 again. So I can certainly clear here if I want to, but maybe I want to see one of those other searches. I forgot that we have the systematic review search I did a minute ago. If you click here on advanced, like I said, it keeps track of research you ran for the last 8 hours. If I want to pull one of these sets back up, so say this 70 results for the review, I can just click on the hyperlink here for that 70, and it pulls those 70 back up. Something else you can do once you start to find articles in PubMed, that we always say to people that it's very rare you get a search right the first time. Search is an iterative process, so you learn some things from a search, you apply that to your next search, and after maybe 2 or 3 searches, you're really dialed in, you really start to find great researches that you're doing. So, for example, maybe this one, number 5, diabetes epidemic in India, where we stand in future projections. That seems pretty good just based on a look at the title. It seems kind of like what we're after here. So unfortunately, we don't have an abstract, which is just, that's up to the publisher sometimes or PubMed themselves. But there are still things I can do to make this search useful. As I said, every article that's in PubMed that's indexed by a person, an actual librarian, an expert, sits down, looks at the article, and attaches the mesh terms they find most relevant. If I want to see what that looks like, I can click on these 2 little arrows here next to publication types mesh terms. So these are the mesh terms that particular librarian used. So there are times when this is really great. So I just used diabetes mellitus type 2 in India kind of broadly, like I said. Say I wanted the numbers of people in India that have diabetes. You can see here under India, there's this slash epidemiology. So that's that subheading, that little box that would be under India for a mesh term. So slash epidemiology, that means that is that mesh term applied. So if I like that term better, so obviously epi is going to show me the numbers, the incidence and prevalence, all that about people with diabetes in India. If I left click on this, I have three options. I could search PubMed now for every article indexed with India slash epidemiology, but there'd be no diabetes in there. I could add this to my search for those 70 articles that came back. It's going to look at those 70 articles just for India slash epidemiology to narrow it down even more. Or I can click here, go back out to the mesh database, start my search again now with India slash epidemiology and add that back myself. So there's a really nice options you can use to narrow your search down. Same thing up here. Here's type 2 diabetes epi complications. So again, maybe that's a better term for me. So it's a nice way to actually find, if you find an article that's good, look at the mesh terms for that article to see maybe there's a better mesh term, a more specific one than the one you used. This actually, admittedly, can take a while though, and this, until a few years ago, was the only way we could do it was to do it by hand. PubMed added a feature a few years ago to make your life a little bit easier. PubMed will run an algorithm in the background looking for other articles indexed in a similar way to this article. So other articles about type 2 diabetes mellitus epi and India epi and say middle age and prevalence, another epi term. And it's going to put it over here in similar articles. So if I click here on see all, it usually shows me about 100 articles, like the article I just started with. In this case, it's only 16 because my filter is still on. Like I said, they are sticky, so make sure you turn them off. Excuse me. So I got 124. And you can see that the article I started with is always going to be at the top. This is a relevance search, so the article you start with is 100% like itself, which is kind of obvious. But you can see as I start to go through here, some of these articles are still pretty good. So this one's probably pretty good. So pregnancy, diabetes in pregnant women in India. Here's one, this screening India's twin epidemic. So that's another study. This one's a little bit broader, but addressing the burden of diabetes. So that's kind of where we started with this question. We know it's a problem. It's a public health epidemic. So this article is more about that broadly, not just India itself. And you can see maybe as you get down here, so they do like a Google search with relevance. It kind of drops off a bit. So now we get tuberculosis in Pakistan, which, you know, I guess it's in the same subcontinent as India, but it's not India. It's different politically and culturally, religiously. And I guess we don't really care about, in this case, tuberculosis. So it does kind of drop off a bit sometimes in relevance. But if you can find even one good article, you can go through and find other articles like that article by using this, excuse me, similar article search. You can also do something, if I click on any of these articles, here I'm just going to click on the very top one again, that you know that people tend to search, or researchers tend to write about the same things over and over again in their career. So you can always search PubMed just for that particular author. So say this Gosal, S. Gosal here is the author. Maybe I want to see what other things this person has written. If I click on that person's name, PubMed does a search just for other articles by that particular person. And they usually try when they can to look, it's kind of a computed search. It not only looks for that person, but that person and their co-authors or that person on the same subject. So you see that all these articles here, so again, India, so this person writes about India, also diabetes, and then again, India. So apparently this person writes a lot about India and also writes again about, say, here's diabetes again. So it's really nice, and again, here's that same co-author, this B. Sina, is right here again. So again, they're here again. So this is probably the same person if they're writing about the same subjects, diabetes in India, with the same co-author, it's probably the same person. So it's a nice way, again, to kind of get, if you know, if this person does good work in an area you find interesting, it'll go through and try to help you find other articles by that same person. And again, the last thing we're in PubMed, so if I click here again on this article here, if BU gets this article, in this case I'm not sure if we do, I can click here to find it BU. This actually should say look at BU, it's going to go out to the catalog and try to find the article. If we do have this particular article, it's going to tell me, so I'm going to say in this case we actually don't have this particular article because I didn't see a link there for full text. So that's fine, this does happen sometimes. And I was saying before that, you know, we do know that there are about 75% of the journals in PubMed, so this unfortunately is one we don't actually have. But something else you can do to make your life a little bit easier, so you notice that if I just go back to all of my results that came up, so I'm going to go back to that 70, just that, you know, the set I found before, it doesn't make any difference what set I look at. You can see here I turned something on in PubMed. I turned on a library filter. So it's telling me of these 70 articles from this particular set that BU owns 19 of those. If I just wanted to see those 19, I can excuse me, click here, and it's only going to show me those 19. So I can get any of these 19 right now. So if I wanted the PDF, say, for this one right here, I can just click on that article. I can click on this link from Elsevier, the publisher, and go right out to the PDF. So it's nice sometimes to limit just the things that you can get to right now. So maybe you had a paper due Monday morning, and right now it's Saturday afternoon. You don't want to go to the library. You can't go to the library. You could limit just to those 19 you can get electronically right now. If I back up again a little bit, I can also see here, I have another option here, free full text. So anybody could get these 10. So PubMed is really trying to add as much free literature as they can. It always goes into this database here, PMC, which is PubMed Central. There are about 25 million articles in PubMed right now. About 3 million of them are free to anybody. This is a great thing to know for public health because there might be times that you're giving a lecture, not at a university. Maybe you're doing field work in India, and the people in your lecture actually want to look at these articles themselves. The average person in the United States isn't affiliated with the library. Certainly the average person in India isn't, or any place else in the world for that matter. So it's nice if you can just limit 2 free resources anybody that's listening to you speak with a computer can get to. You can also see I put here as a limit that Harvard University is here too. So Harvard University is not part of the BLC. I talked about the BLC a minute ago with those cards. You could go to those 17 area libraries. But Harvard does allow our students to use the Countway Medical Library. So if you wanted to use Countway, all you have to do is show up there with your BU ID and just explain. They have a guard at the door. Just say you want to use the holdings there, your BU student. They'll let you in. You can't check things out from Countway, but you can use any of the journals that they have. So you could save this search, and I'll show you that just in a second. You could go to Countway, go to any of their public access terminals, sit down, start to find these articles for yourself and pull them up at Harvard, get the full text PDF, email it to yourself, again, Dropbox, USB stick, whatever you want to do. So it's a great resource we have available. Just while I think about it right here, I'm just going to open up a new tab here and just go back to the library homepage. So again, I mentioned we do have access to Countway. So if I go to library catalogs again here, other catalogs, and go down to the bottom here. So here's our information about Countway. So you can see that, so School of Public Health faculty and students are allowed to use Countway. If you wanted to actually look at their webpage to see what their hours were or directions, it's right here. It's just the Longwood Medical area down Huntington Avenue. So it's probably about 2 miles from BU Medical Campus, very easy to get to. So again, you could just go there. Any of the articles you wanted to use, you could just go there and use those. And you see, right, they mentioned this right here. So the Boston Medical Library, the Countway is the official library of record for the Mass Medical Society. So, our medical students and our clinical faculty use it there as well. So how do I turn this thing on? How do I make PubMed know that I can use Countway? So you can see that I'm actually signed in to my NCBI account right here. I'm going to sign out though. So normally when you go to PubMed, it's going to look like this. So it's going to say sign into NCBI. So I would definitely recommend to you, I'm going to turn this off because again, the sticky limits always will stay on. I would definitely recommend to you, as soon as you watch this tutorial, maybe even pause it right now if you want, or when the tutorial's over, whatever you want to do. Definitely go out here to NCBI, make an account. So in your case, you're going to click here, register for an NCBI account. It's totally free. I already have one, of course. I'm just going to log back into my account here. So what you can do with an account, which is fantastic. So once I log in, and again, I can pull up one of these searches here. Again, my advanced, I haven't logged out, so for 8 hours, I'm going to remember. And I can pull up any of these sets here. And again, here's that list. So if I click here, when you come here, it's probably just going to be, I think, review and full text are going to be the two here by default and all, so there won't be any particular library one. You can just click here on Manage Filters. It's going to take you to this page here for your filters. So if you want to add BU or Harvard or both as your library, or maybe your undergrad library you went to, you still have access electronically. Sometimes that happens. They leave it on for like 3 or 6 months. So I'm going to go to link out here. Then I'm going to go down here to libraries once this kicks over. I'm just going to find that particular library. So I'm going to go to, say in this case, I guess it's a little bit slow today. I'm just going to go to that range. I'm going to say if I want to add BU. So obviously BU is going to be in A through C. Once this shows up here. Again, a little bit slow, but when it does show up, you're going to see Boston University there as an option. Then I can just click on that. And once I click on that, it's going to show up over here in my filter list. So those are the things that PubMed is going to let me filter by automatically. So For some reason this is slow, I'm just going to abandon this because there's no point in me sitting here doing nothing, but you definitely should do this. So click on this A through C to add that to your library as BU as a filter. And again, you probably want to add Harvard as well, just to make your life a little bit easier. Something else you can do, so I'm going to click here on My Account. So I have quite a few things in my account. I just do searches for people all the time. We're certainly here to help you as well. So if you need help with the search, any point of the time you're at BU, you can certainly email me. I'll give my contact information at the end. Or you can come to see any of the librarians. We're happy to do searches for you. We'll do a search with you. We can do a search for you and send you the results, whatever works best for you. So you see I have quite a few searches here in my saved searches, and I've deleted some that I don't use anymore. These are the same filters we just saw for the libraries. Collections, so PubMed will also keep track of all the searches you did for the last 6 months in this recent activity, which is nice because I do a lot of searches in the course of a day, and sometimes I forget to keep track of those. It does it for me, which is nice. But anyway, I'm just going to go back to my regular sort of PubMed account. So say I was working on an assignment for one of my courses, and I built a really good search strategy. So say I have an assignment due in a month, and I want to just stay current. I don't want to do the search every day. I want PubMed to do the search for me automatically. So if I go back here again to just my advanced search for the searches I've run over the last 8 hours, and again, say I want this really big set, this 920. So you see where it says here, create alert. If I wanted to, I can click here, and I could say to PubMed what I want to do. I want you to run this search every single day and just email the newest. So it's not going to send me these 920 again. It knows I've seen these 920. So I could say once a day, once a week, once a month, whatever I want to do. And honestly, most people do it once a week. They don't do it every single day. So I'm going to say just weekly here, and every Monday, send me newest results. So it's going to, if anything new is added to this search in the next week, so between now and, well, I guess it'll be this Monday, so a couple of days from now, it's going to automatically email that to the address I used to make my account. So I would always change this to 200 because you're not going to get, say there's 8 articles, you're not going to get 8 articles and 192 blanks. It's just going to send you the 8 articles. But if I just choose 5 here and 8 articles are found, I'm never going to see 6, 7, and 8. I'm only going to see 1 through 5. So I always make that as big as possible. So I really don't want to do that, but I certainly have the option. I said you also can do something called a collection. So a collection is just a static list. So that would just be a list of these 920 articles. It's not going to add to that, but sometimes that's nice. People sometimes like to save that so they can put that into like Zotero or Mendeley or something, and I'll show you Zotero at the end. Or they just want to email somebody that static list. So it's up to you, but there are 2 ways you can kind of save your search. The collection is just this list of 920 as it is now, and saving the search up here from Create Alert will go through and just anytime that search is added to and the results are added to, it's going to update that for me automatically. Really just one last thing I want to show you while we're here, which is nice too, that there might be times, and I'm going to go back to the really big set here of that 11,000, because I don't think this is really a very useful search in this case, but again, I'll just go back to it in general. So say you're looking at diabetes mellitus type 2 really, really broadly, and you want to find somebody at BU who's an expert in that particular field. Something else you can do with that advanced search, not only can you look at, like we did the actual searches we did, but you can actually change this drop down here. So if you knew an author's name, you could actually just type in that person's name directly if you knew their author name already. But with affiliation, you can actually just put in an address. So this would be the mailing address of the first author of whatever article you're looking at. Sometimes PubMed finds other authors, but usually it only guarantees the first author, but we can see what happens. So if I'm looking here for Boston University, so this would be every article in PubMed with at least the first author being a person from BU. If I go back here to advanced and just combine that with my, say, set for diabetes. So if I want to find somebody on the BU campus who is an expert in diabetes, I can have PubMed find for somebody this way too. So that's nice, and that works. If I wanted just somebody in Boston, I could just put Boston as my resource. If you wanted somebody at MGH or somebody at Harvard or MIT or Tufts, whatever your choice is, or whatever school you went to before, say Michigan, you can always put that either state or that city like Ann Arbor from Michigan, or the University of Michigan, whatever it is, to find somebody at that particular location who's an expert in that field. So sometimes you just need help. You just want to talk to somebody, ask somebody a question. And this is a nice little trick that PubMed does to sort of let you get your hands on that type of information.